Hello everyone, and welcome to this audio podcast. This audio podcast is part of the Assay, this Assay edition. This is an audio podcast, an overview where this will be an interlude, or the first interlude, sort of interlude one, as part of this as part of the within as part of this series, or within this series. Um, and This is an audio podcast as part of an Assay edition, and also as part of the Biomed Monster. And this is an audio podcast as part of a a an evidence base and storm robotics production. So in this overview, or in this podcast, the overview or interlude will be in around looking at healthcare through audio podcasts and art, perspective on chronic kidney disease, CKD, a collaboration between the renal patient support group, the RPSG, and the kidney disease and the renal support group, or KDARS for Kids and Storm Robotics Productions. The overview is as thus. So, chronic kidney disease (CKD) is sort of recognized as a silent, irreversible long-term condition, or LTC, and tends to establish itself as a health complication and or comorbidity. Service user access to educational support surrounding kidney care. Kidney care can be challenging between health sectors owing to clinical environs, and in around the aims of to understand how in around the aims it was to understand how audio and podcast and art offer a collaborative basis for service users and service providers to align healthcare practices. In around the objectives, the audio podcasts and art have been focused between two leading educational social media platforms to help highlight pertinent aspects surrounding healthcare and disease. And in around the design of this works, in around this, the audio podcast and art are here or around this works focus on how healthcare professionals and service users could be working together through social media to improve experiences. In around the results of this works collaboratively and between the RPSG, KDARS, the RPSG, KDARS, and Storm Robotics Productions, there are several social media platforms, including 4 YouTube channels and 2 SoundCloud channels with over 600 audio podcasts and educational webinars, highlighting context surrounding service users and service providers, and surrounding nephrology and pediatric nephrology, science and kidney care. Audio podcasts and art can prompt service users and service providers to join up healthcare. So in around the conclusions, the RPSG supports over 10,000 service users amongst the adult population, population suffering with different forms of kidney disease, and KDARS is supporting near and close to 2,000 service users amongst pediatric and young people population suffering with different forms of kidney disease. Audio and podcast and art can help incorporate practice excellence. Thank you for tuning in on this audio podcast. Sort of interlude as part of the Assay edition. This has been an audio podcast as part of an Assay edition, and also as part of the Biomed Monster. and this is an audio podcast as part of an evidence base and another Storm Robotics production. Thank you.